the monthly Strengthening Families Networking webinar for the month of November. Today I'm excited to share a lot of great content with you. We're going to be talking about Essentials for Childhood, the framework from the Centers for Disease Control and Prevention, and hearing from 2 states about how they're implementing it and how it connects with their Strengthening Families work. So good to check back in on that. We will start with some updates from the Center for the Study of Social Policy and the National Alliance of Children's Trust and Prevention Funds, as we usually do, and then we'll get into our content with those updates on the Essentials for Childhood. So without further ado, I'll jump in with our updates from CSSP. I'm Kaylin O'Connor. I'm a Senior Associate at CSSP. I facilitate these webinars each month. It's an open invitation to anyone who's interested in the topic of the month and how it connects to using the Protective Factors framework. We convene this jointly with our partners at the National Alliance, who have been strong partners in implementing Strengthening Families for the last 12 or more years. Each month we have a topic related to Strengthening Families and guest speakers. We coordinate that. We are always welcoming suggestions and volunteers to present on a webinar or to facilitate a conversation, and just looking for different ways to use this time when we pull people together from around the country. We always post recordings and slides and other materials from the webinars on a site that the Alliance maintains. It's a Google site. It's actually a really rich archive at this point of a lot of Strengthening Families content and sort of recordings and slides of how people are using the framework. Take some time and browse through that if you like. I should mention that today's webinar recording will not be posted immediately as we usually do. We're needing some CDC clearance on materials. I think everyone knows how that goes. The larger the agency, the longer the security clearance process. So once those are ready and cleared, we will be happy to share the recording, and we will send out a message when those are available. So we do these webinars typically on the 2nd Thursday of each month. You'll notice today is the 3rd Thursday. We're doing that because of a conflict last week for both our colleagues at the Alliance and for some of the folks presenting. So we're happy that this worked out this month, but we'll be back on our 2nd Thursday pattern next month with a webinar on December 14th, same time, same place. We'll be hearing about Strengthening Families Kentucky and all the work that they're doing to implement Strengthening Families in one of the newer states in our national network. And then we've got topics scheduled for January, February, and March. We are going to jump into 2018, continuing our good work and continuing to connect around these topics. So please plan to join us 2nd Thursday of each of those months. Many of you have seen this in the newsletter, but just wanted to mention it again. I'm updating the Strengthening Families Speakers Registry, where I have been having people sign up to let other people know that you're available to speak about Strengthening Families. There's a place you can check the different types of implementation of Strengthening Families or connections to Strengthening Families that you have. So that people know if they're looking for someone who can speak about Strengthening Families and child welfare, they'll be able to find those people. If they're looking in a particular state or city, they'll be able to find those people. We're starting this list over again since we had one that we created about 3 years ago, and some of it was very out of date, and it was getting difficult to update. So we've got a new one going. Please sign yourself up if you are interested in speaking, and let me know if you'd like to see that list if you're looking for a speaker. I also want to thank everyone who responded to our Strengthening Families survey over the last month or so. We had over 300 people respond, which was more than I hoped for, so I'm very grateful to everyone who took their time. We had 3 randomly selected winners who are getting a 30-minute technical assistance consultation over the phone. Debbie in Colorado, Marjorie in Pennsylvania, and Michelle in Vermont. And those survey results, of course, are going to inform our future work. So I will be sharing those over the coming months. Those of you who are state leads, if you had more than 10 people from your state respond, I will send you the data for you to look at yourself of what people said they're using the framework for. And I'm excited to really dive in and see everything that everybody wrote in about the directions they are taking Strengthening Families and want to take it. Okay, sorry, here we go. I wanted to call your attention to a new handout that's available on our website. If you go to strengtheningfamilies.net, under the About Strengthening Family section. This is right at the top. It's just a front and back one-pager about strengthening families and the protective factors framework. It has our logic model and the everyday actions that build protective factors, which both of those graphics were designed by the National Alliance of Children's Trust Funds. And I realized that there was an older handout with our old logic model on it that some people were still using, and so I wanted to make sure there was an up-to-date version with our current graphics, our current definitions of each protective factor. So you can find that on our website and use it in anytime you need to just give people a high-level understanding of what strengthening families is all about. Okay, I'm going to hand off to Martha for some updates from the National Alliance.
Hello, everyone. This is Martha Reeder. I'm a senior associate with the National Alliance of Children's Trust and Prevention Funds. And I would start today by sharing with you about an event we have coming up with our Birth Parent National Network. The Birth Parent National Network, it has more than 200 members, and it really is an organization both for parents and for organizations and those that want to support parents in their work to help reform the child welfare system. And it has become a really great network of parents across the nation. And if you would like to join, here is the information about how you might do that. It's a very simple little application that you fill out, and here's the information how you can access that application on our website. And but the event that I wanted to tell you about happens once a year, and it's called the Virtual Convening. We do so much of our work in this virtual environment, and because sometimes it's difficult, especially when you're working with parents and you really want them to participate and give them the most opportunities to participate. Because of that, there are two sessions of the Virtual Convening, one on Thursday, November 30th from 10 a.m. to 12 p.m. Pacific time, and one on Tuesday, December 5th from 10 a.m. to 12 p.m. Pacific time. And you can register for both of these. I'll show you just a quick look at what the agenda will be. On Thursday, November 30th, we will have Dr. Nancy Young talking about what works, how to support families affected by substance use disorders, and then a parent presentation by two members of the Birth Parent Network, and talking about birth parents and foster parents working together to create change. And then another parent presentation by Corey Best and Tony Miner about building and sustaining strong recovery communities through prevention strategies. So it's a very full agenda on that day. And on December 5th, Tuesday, December 5th, Dr. Bob Segi is going to be sharing with us about the HOPE initiative, the health outcomes of positive experiences. And after he presents, then the co-chair of the Alliance National Parent Partnership Council and I will talk about a new training about preventing child neglect. And then Jim McKay, our public policy person at the Alliance, and Victoria Hilt, another parent from our Parent Council, will be sharing about strategic messaging in order to build a prevention-oriented society. You can see that these agendas are very have some very interesting topics and some very good speakers that will be sharing with you. The registration link is at the top of both of these pages, and as we post, we may post a partial PowerPoint until we get the full PowerPoint, so that you can access some of these links that you need. You can also put those in the chat box, Kaylin, before when I finish here in a few minutes, if people are interested in doing that. One other thing I want to share with you as we go on is that the Alliance National Parent Partnership Council has been working on a group of tools called the NeedtoKnow Tools. We call them that because they're short and concise and have information that they think you need to know. And you can see web link at the bottom of this slide. All of the Need to Know tools are there. You've seen some that we've shared with you in the past. If we look at the next slide, you can see that we have a new tool on social connections. This is like the parental resilience one that we developed, and we have one on knowledge of parenting and child neglect that's coming up hopefully in the next month or so. And then the remaining two, we're going to use a little bit different format to generate the input from parents through some forums across the country, some focus groups, and on the last two on social emotional and on concrete support. So, but this one is available now on our website, and I hope you will go and download it. It's also a handout on your webinar today. And then finally, the next one is really the compilation of all of the parent translations, the flip sides of all of these protective factors infographics have the parent translation on the back, but we generated this one just as a full catalog of all 5 protective factors and what parents across the country, how they are expressing those protective factors. And we hope this will be a great tool for you to use in your work with parents. Thank you, and that's all that I have today, Kaylin.
Thank you so much, Martha. These are great resources, and it's always cool to see what the parents are working on. So thank you, Martha.
You're welcome.
Now we are at our main topic for the day about essentials for childhood. So we're going to have a quick review of the framework and how it relates to the protective factors framework. And then we'll hear from Massachusetts and Washington about how they're implementing it in their states and how they're making those connections. So I'm first going to introduce Sandra Alexander from the Centers for Disease Control and Prevention, a real leader in our field of child abuse and neglect prevention. And she's going to talk about the Essentials for Childhood framework. Sandra?
Thanks. I appreciate the opportunity to join you today and do a quick review of the Essentials for Childhood framework and initiative. I'm sure that many of you are familiar with it and probably involved in it in one way or the other. And we're excited to be able to be at a point where we have states who are able to share as well what they are doing with both the Protective Factors framework and the Essentials for Childhood framework. So as many of you probably know, Essentials for Childhood, assuring safe, stable, nurturing relationships and environments for all children, is our vision. That's what we want for all children. And it's also serving as the unifying framework for all of the CDC's child abuse and neglect prevention work. Next slide, please.
Sandra, you should be able to advance yourself. Do you want to give it a try? Otherwise, I can advance for you.
Try one more time. I'm not moving. I'm sorry.
Okay. I will click it there, and I'm happy to advance them for you.
Okay. Sorry about that. I don't know what's wrong. So the framework has 4 main goal areas that we think are important to work on to be able to create the safe, stable, nurturing relationships and environments and also prevent child abuse and neglect. And the goal areas are raise awareness and commitment. And we really mean also build political and social will for preventing child abuse and neglect. The second area is using data to inform action, becoming familiar with what the data is available that tells us about the condition of children and families in our communities and our states, thinking about what more information and data is needed, forming the partnerships that are needed to get that data and to share the data. The third and fourth areas are around creating the context for healthy children and families, really creating that context through norms change and through programs, and creating the context through policies. And while each one of these individual goal areas are important, the 4 of the goal areas together, we believe, are more likely to lead to safe, stable, nurturing relationships and environments for children and preventing child abuse and neglect. And throughout all 4 of these goal areas, there's an emphasis on social determinants of health and equity as an important part, cutting across everything that we do in all areas of the framework. Next slide, please. we have been able to fund 5 state health departments to work with many different partners in their state to work on the Essentials for Childhood framework. And many of those states were already involved in using the Protective Factors framework when Essentials for Childhood started. The 5 funded states, 2 of which you'll hear from today, are California, Colorado, Massachusetts, North Carolina, and Washington. And it's been really exciting to see the interest around Essentials for Childhood throughout the country. We have about 31 states who did not receive any CDC funding, but who've been participating in the initiative as partners in some way or the other. We've opened up all of our training, all of our technical assistance, all of our meetings, in-person meetings, to any of the self-supported states that are interested and are able to participate. So that's been really exciting, and we've been learning from each other. Next slide, please. So what we've asked the essential states to do is, of course, work in the 4 goal areas of the framework, but really focus on the context, creating that context that can support families and children so that they are safe and stable and nurtured in their relationships and their environment. To really focus on health equity and health inequities and look at the kinds of relationships and conditions between social and economic contexts that place some of the children more at risk than others, and then leads to inequitable health outcomes. And a really key part of what the essential states are doing is forming partnerships. Some of the required partners for them are the state health department, the core entry program if there is one in their state, their CBCAP lead agency, and 1 or more of 3 national prevention organizations, Prevent Child Abuse America, the Children's Trust Fund, or Parents Anonymous. And we have asked them to engage with some of the maybe more non-traditional partners, like the business sector, and maybe the media and others that they identify as important to the work in their state. They're also using a collective impact process to achieve the vision of safe, stable, nurturing relationships and environments for children. And many of you that are involved in collective impact approaches know that it's very strategic and it's not easy. You have to have influential champions, you have to have some financial resources, and probably most important, there has to be an urgency for change among your partners and within the group to change and recognizing that there's a problem and that we aren't okay with the current state. And it also requires multiple sectors involved for the change to happen. That means having engaged funders and engaged policymakers and sectors like the business sector and the media as well. Next slide, please. We developed over the last several years a number of different resources to help support the work of the Essentials for Childhood states. There's one on promoting positive community norms, because we think norms are really important to understand and to see where there's opportunities to promote positive norms that exist, but also to work on changing the narrative and developing new norms in a number of different areas. There's also one on building community commitment, one that can be used when you're working with employers or the business sector on Boost Your Competitive Edge. It lists different actions for healthy and productive workforce and ties them to how it can also impact assuring safe, stable, nurturing relationships for families and children and for their communities. We have a guide on suggested practices for journalists on reporting child abuse and neglect, because as the people on this call know so well, most of what is in the media is around the tragedy or the extreme circumstances and the failures of the different systems, etc. And we really want to work with the journalists and the media to help them see how they can cover child abuse and neglect in a more comprehensive way and really focus on the conditions that we want and what it is we want and how to get there and what's happening in the community and what else is needed. Two other more recent resources are Preventing Child Abuse and Neglect, our technical package for policy, norm, and programmatic activities. I expect and hope many of you have seen that. If not, that and all of these resources are online and available. I'll talk a little bit more about the technical package in a second. Another one is Making the Case, Engaging the Business Sector. Next slide, please. This particular one on engaging the business sector is an online resource on our Veto Violence webpage, and this is just a screenshot where you can go into different sections like understanding child abuse and neglect, benefits to business, using your existing skills that you have for building partnerships to build partnerships with the business sector, and how to build a business partnership, and then examples of different ways that employers and businesses can be involved, from very simple things that require very little time or resources on their part to more extensive and long-term types of partnerships. So I hope if you haven't that you'll take an opportunity to check that out if it would be helpful to your work. There's a real opportunity now in getting the business sector and employers understand the importance of family-friendly work policies and things that can help to bolster the economic conditions of families and how that can impact their bottom line as well. Next slide, please. This just gives you a glimpse of the strategies and the approaches that are in the technical package for child abuse and neglect. And these are arranged from the ones that have the greatest potential for broad public health impact on child abuse and neglect to those that impact more select populations. So really looking on some of the contextual things and policies like strengthening economic supports for families, changing social norms to support parents in positive parenting, providing quality care and education early in life, enhancing parenting skills, and then intervening to lessen harms and prevent future risks. And on the right side are approaches for each of those strategies. And each of these are intended to work together so that when you use them and have them in combination, they reinforce each other. Excuse me, next slide, please. So when Essentials for Childhood started, we were getting lots of questions from different states and individuals about, so how do we make this Essentials for Childhood framework and the Protective Factors framework work together? I mean, we're already doing Protective Factors framework. So we worked together with Strengthening Families to come up with a document several years ago to try to give a really quick summary of how we saw these two frameworks being alike and different and complementary. I think one of the handouts that's posted on this webinar is the document that we came up with. So I'm just going to highlight a couple of things from that right now. So one of the things that we know is that both the Essentials for Childhood framework and the Protective Factors framework have a shared goal of assuring that children have those safe, stable, nurturing relationships and environments, and that our overarching approaches are about shifting the environment in which families live so that they're safe and secure and nurtured, and so that it's easier for parents and caregivers to provide the kinds of things that children need. Next slide, please. And we know that there's some differences as well in the context and the environment that are the focus of each of our frameworks. Both are concerned with relationships within the family context, but Strengthening Families primarily is working to influence relationships by intervening in programs and systems where families interact with professionals. And the Essentials framework focuses more on the broader environment, the context, and the larger forces that influence communities where families live, work, play, And then that in turn influences relationships at the family level. Next slide, please. So I think you can see from this graphic that the focus areas of both of the frameworks are shown here. And what we see, I think, is that when you use them together, they can help to create a comprehensive prevention approach that spans the social ecology. So I think it's exciting to see this possibility that when they're used together, we really can get closer to a comprehensive approach that really focuses both on the context and on specific types of programs and individual interactions. And I think it's exciting that we're going to hear next from a couple of our essential states and about the great work that they're doing in using both of these approaches and frameworks. Thank you.
Thank you so much, Sandra. That was really helpful. Great overview, a reminder for those who may not have checked in on Essentials in a while. And I'm very excited to now introduce our speakers. Sorry, I'm juggling the technology a little bit here. But first we're going to hear from Washington State, where we will hear from Marilyn Gisser, who has over 20 years experience in Washington State government, public health, and health services planning and administration. She has served as the Washington State Essentials for Childhood Coordinator since 2013, and she will be joined today by Susan Barbeau, who is from Pierce County, and you'll hear a lot about the great work that they are doing there in Pierce County. So with that said, I am going to hand it over to Marilyn.
Great. Can you hear me?
Yes, you sound great.
You can hear me, and are you going to be advancing my slides, Kaylin? I think that would be fine.
Okay, I will do that.
Okay.
Thank you.
Yeah, I'm just going to take a few minutes and tell you about Essentials for Childhood in Washington and just a little bit about how we are using protective factors, and then kick it over to Susan, who's the Executive Director of Project Child Success, which is a great community initiative in Pierce County. So a lot of what I'm going to say is going to sound kind of like a repeat of what Sandra said, but we were one of 5 states that was awarded a CDC Essentials for Childhood grant in 2013, and we really took it to heart that it was to support collaboration to promote this vision of safe, stable, nurturing relationships and environments for children and families. And we've been fortunate that we've been able to kind of leverage that small CDC grant with some private funding and other state funding to have the staffing to support the collaboration, as well as the participation of a huge pool of partners. And I believe that we got the grant because Washington really had a strong history both of state level and community level work on addressing ACEs, toxic stress, and trauma and resilience, as well as the history of communities and different organizations and the state using the protective factors framework. So we really saw, and I believe the CDC saw an opportunity to really build on all that work and expand on it, align it. So next slide, please. So just as Sandra said, we were asked to do a collective impact approach, and we have, this is just kind of showing you, we have work groups, and we have this big ecosystem of partners that's this kind of cloud in the middle, and a steering committee, which even though it's off to the side, the work groups and the steering committee, they all come from this bigger ecosystem of partners. They connect to it, they build on it, and it's a cross-sector ecosystem we're connecting to. Some of the ones Sandra mentioned, and we have early learning, health, education, violence prevention, domestic violence. I know I'm missing, there's others, and both private and public, and philanthropy, and a really strong interest in Washington in connecting to and lifting up communities, because we have some really great community-based work in Washington, and I think we've been working all along really to figure out how do we bring that community voice to the table, how do we lift up what's working in communities, expand on it, and make it work better, or not make it work better for the communities, but really help them connect to each other. So continuing on to the next slide, here's our vision and our goals. Our vision should look familiar. It comes from the CDC vision, and our steering committee settled on these are very long-term, high-level goals of increasing kindergarten readiness, improving child health status, and reducing adverse experiences. And we focused on these because we believe that by enhancing safe, stable, nurturing relationships and environments, we will see movement on the needle on these 3 goals. Next slide. So there we go. So I wish I could tell you about everything we're doing in here because we're in our 5th year and it's really exciting, but I'm going to focus on protective factors and leave Susan some time. All along, our partners have really recognized the value of protective factors and kind of wrestled with how do we connect that to our work, wanting to connect that to our work. And we're really seeing pretty recently the germination of that in a few ways that I just want to let you know about. One is in data collection. We have a dashboard, and we are looking really closely at how we can add protective factors to that dashboard. We're going to be considering developing some recommendations around that, and I'm hopeful that we'll see some action on that in the future. We also have a work group that's focusing on systems change using the Help Me Grow framework. They're trying to promote the Healthy Growth framework and expand it to connect families to all the services they need. And they're working on a theory of change which is showing how Help Me Grow is going to result in enhanced protective factors and safe, stable, and nurturing relationships and environments. So I'm really looking forward to seeing it. And finally, we have a lot of really great community-based work that we're lifting up, and that's why I wanted to feature Project Child Success on this webinar, and Susan's going to talk about their work they're doing in Pierce County. Just listening to Sandra talk about, as they were thinking about a few years ago, the connection between the Strengthening Families framework and Essentials framework and how the context is important to those protective factors. And I think, as you'll hear from Susan, they're really doing a great job at Project Child Success and other partners in Pierce County in putting that whole vision together and enhancing protective factors and thinking about the environments they're in. So I will kick it over to Susan now.
Great. Thank you, Marilyn. Can everyone hear me okay?
Yes, you sound great.
Yep. Okay, great. Well, thanks, everybody. As you mentioned, my name is Susan Barbeau. I am the executive director of a nonprofit in Pierce County who leads the work around Project Child Success, which is a grassroots community initiative around growing a child-centered community. And I just want to tell you a little bit about where we're at and about Pierce County. So we are located in Washington State, exactly in the middle between Seattle and the capital in Olympia, Washington. It's about 30 miles each direction to those. And Pierce County itself is a really large county, so there's roughly 850,000 people, 70,000 children under the age of 6. We have 13,000 military children approximately. We're home to Joint Base Lewis-McChord, which is a large military base. And we are increasingly racially diverse, with both Hispanic and African American communities being the largest minority populations. And then we're also a mix of urban and rural. So on the rural side, we're the home to at the foothills of Mount Rainier National Park. And on the urban side, we are also home to the 3rd largest school district in the state. So very diverse county. And I should have mentioned on the previous slide, you also saw a map. We're also one of 10 early learning regional coalitions across Washington State, and so connected to statewide policy work that's happening for child well-being. So Project Child Success is really about growing a child-centered community in Pierce County, and we bring together cross-sector partnerships of over 100 organizations and individuals who have come together around a shared vision around change for our kids. And the partners are diverse, from libraries to K-12 education system, to healthcare, to businesses, to families and individuals who are even participating. And we too use a collective impact model for organizing. So we have a steering committee and action teams who meet on a regular basis. And they have all come together around this shared vision, which is that all children thrive in nurturing relationships and environments. It should sound familiar to you, very much aligned with the Essentials for Childhood vision, but it's slightly different, and that is intentional. So the pieces that we leave out are the safe and stable portions. And one of the reasons that we've done that is because we are being incredibly intentional about this being a community-driven process and something that the entire community can buy into. And so we want to make sure that it's as accessible as possible. And so you'll see that we've gotten rid of a lot of jargon language as much as we can so that it's accessible to be a community strategy. And so we are operating under the assumption that if it's a nurturing relationship and an environment, that it's also going to be safe and stable. The commitment from partners who all work together is that they are cultivating community action to strengthen Pierce County families. This is pretty important because what you won't see from us is you won't see a commitment to indicators. So you don't see this to say, you know, we're going to cure kindergarten readiness, we're going to save graduation rates. What partners have said that they want to be committed to is the actual action, is the actual work. And so that's where the development of the commitment came from. And then the problem that we're trying to solve, this is pretty much a visual of what Sandra had talked about at the beginning, which is that we know the root of adverse childhood experiences and the individual context in which toxic stress can have an impact on child development. But at the same time, we also know that there's adverse community environments. And so we refer to the work as really this kind of called the pair of ACEs, both the adverse childhood experiences as the individual experience and the adverse community environments being things like poverty and discrimination and those things that require those systems change. And it's the pair of both of these together that are going to be able to lead to ultimate real change in our community. So we feel that our solution then to this problem needs to also be a two-pronged approach. So you have community-driven strategies to enact the policy system and environmental changes needed, combined with the building the 5 protected factors on an individual level to help buffer that adverse childhood experiences at an individual level. So the protective factors are one way that we have identified as a way to do that. So, and when we talk about the protective factors, we really are talking about from a community-driven approach under the idea and influence that we're growing a child-centered community. So when you ask people, what does it mean to grow a child-centered community, we mean that it's a community that is strong in all of these five areas, both as individuals, but also as a large community for the entire population of Pierce County. And so to do that, to have the protective factors be a community-driven approach, we also said that it needs to be owned by community. And so these definitions that you'll see up on your screen and the icons were created by our community in Pierce County through our action teams. It was a painstaking process that took a lot of community buy-in to accurately figure out how to represent visually what the protective factors each meant, and then a definition that is different and adapted from the Strengthening Families framework, because again we wanted it to be as accessible as possible, and so paying very close attention to things like readability scores and how does this work for individual families and how can it be broad enough that everyone sees their work in this. We've gotten amazing feedback from it so far in it, and our next step after being able to build the icons was to really create with promotional materials to tie it back to this idea of growing a child-centered community. So this is the flyer that we have, and this flyer has been presented a lots of different places in our community, at our Department of Health, to city councils, at our county councils, to leaderships, and then also organizations are using it even to hand out to families. So it's very broad, vast audience. And then Our next step of what they're currently working on, partners are posters. So these are protective factor posters that will go up to over 100 community partners all throughout the community and throughout the county to be able to really show how these protective factors are being implemented and to give some ideas, and then also having space for people to write their own. We're also developing with it an elevator speech sort of thing so that the community can have similar language around how we talk about the protective factors, how we promote it, and how it's attached to this idea of growing a child-centered community. So this is currently in the works. And then the other piece we've been working on is these child-centered community conversations. So all throughout Pierce County, we have had conversations where it's pretty simple. We basically go in and gather groups of people together. These have happened in a bar, after a church service on Sunday, in individual family homes. Next week there's going to be one happening at our local rescue mission, another one working at the Family Support Center. And the process is to ask basically one question of the people that you've gathered, which is, imagine you were placed in the most child-centered community in the universe. What would you see and what would you notice? And folks have been talking about this one question for about 2 hours at a time. And we've been capturing everything that they've said in terms of vision. And then at the very end of the conversation, we hand them our Protective Factors flyer. And it's been pretty remarkable to see sort of the light bulb that goes off, because all the comments of what people envision and from themselves and the kids in their future fall into one of the 5 factors, protective factors categories. And so it's a way at the end for us to introduce the protective factors. Then we have taken all of the comments that they've said and we have divided them up amongst protective factors and put them on our website. So if you went to the Project Child Success website, you can see this as a data dashboard. And so it's a live collection of all of the comments. And our action teams are now analyzing all of the comments to look for themes to get to that eventual, or to get to that action and that activity. Our ultimate goal is to bring all of the folks who have contributed to the process back together and do a participatory budgeting process where they would have actual cash dollars to be able to look through all of the comments and decide where they want the cash to be spent to help build the vision of the community that they've come up with. That is in the future for the hope, but these conversations have also led to action just through the conversations. And one example is one conversation that I participated in this concrete support piece. There was the comment that a parent really wanted to have access to more parks, but that they didn't have a park near them, but they lived next to a school. And so that they had hoped that the school would just leave the gate open so that they could take their kids and play in the schoolyard. Another family who was at this conversation said, well, what do you mean the gate at your school is not open? The gate at our school is open and we go there all the time and play after hours. After more conversation, they realized that the school that the gate was closed was from a low-income neighborhood, and the gate where it was open was from a higher-income neighborhood, and it was all the same school district. So the families themselves thought that this was something that needed to be resolved, so they have planned to go to the school board at the school and ask for it to be a school-wide policy, the best use of taxpayer dollars, that gates be left open so that families can have access to be able to play. And so I just share that as an example of seeing that as a concrete support and how sometimes just conversations lead to incredible action itself. And then the last thing that I will share in terms of nurturing relationships and environments is a very cool idea that we have been working on, which is wanting to be able to honor nurturing relationships and environments as you see them happening in action. So partners have developed these buttons, this is the Project Child Success logo, and they are encouraged, partners are encouraged and are doing it as they are about in their ordinary day, and they see a nurturing relationship happening between a child and adult, to honor that relationship as it's happening by giving the people a button. And so that it requires a lot of courage on our partners' part and individuals' part to go up to a complete stranger as you see something great and great interaction and just saying, I see you, I care about you, you're growing a child-centered community, keep it up. And we're hearing incredible stories about how it's impacted both the button giver and the button receiver as parents are being honored by random strangers in their community who just see them doing wonderful, great things. So we've given out 1,000 buttons so far, and we're entering in 2018 with the hope that we'll be able to do another 4,000 more, and it's really taken off like wildfire, so it's something that we're really proud of. And so I think that is it for now. All of the materials that I mentioned are on our Project Child Success website. Feel free to go there. My contact information is also up there, so if you have any questions, I'm happy to answer them at the end of this webinar, but also my contact information is there so you can contact me at any time. Thank you.
Thank you so much, Susan. I love all the details you shared, and you're doing great work there in Pierce County. Thank you for taking the time to present it to us. We're going to move next to our partners in Massachusetts, and we are going to hear from both Sarita Rogers, who's the Director of Home Visiting at the Children's Trust, which is the CDCAP organization, and part of the co-backbone organization for Massachusetts Essentials for Childhood, and co-chair of the Data and Evaluation Collective Impact team there. And then we'll also be hearing from Deb Muchler, who's an independent consultant serving as the coordinator for Massachusetts Essentials for Childhood and the co-chair of the Raising Awareness Collective Impact team. So I want to hand it off to Deb and Sarita, and I think you're both on the same phone line, and I want to make sure we can hear you, so go ahead and speak. Perhaps not. Hold on. How about now?
Hi, here we are.
There you are. Great.
Okay.
Thank you. And would you like me to advance your slides for you?
Yes, please.
Okay, will do. Thank you.
So this is Sarita, and I'm going to start, and Deb will jump in just a few minutes, and we'll both be talking quickly about our Essentials for Childhood project in Massachusetts. And I'm really happy to say that a lot of what you've already heard happening in Washington mirrors some of the approaches we've taken in Massachusetts as well, and that's exciting. So great minds obviously think alike. So just as quickly about how we got to Essentials for Childhood here in Massachusetts. As in Washington and in other states, we've already had a strengthening families movement that was a part of our work, particularly at the Children's Trust. So we have had strengthening families trainers. We've done a lot of strengthening families training, both for our Children's Trust funded programs and our other collaborative partners here within the Commonwealth. And so when we started doing Essentials, it became very clear that there was a really great fit already between both Essentials and the Strengthening Families work that was in existence already in Massachusetts. And so we were hoping really to build on that. And then it was very easy for us to think about how we were infusing the protective factors into our framework. And I'm going to borrow the term that Susan just used about community-driven protective factors integration, because that's exactly the same way that we began to think about and approach our work within Essentials. That while the protective factors framework is a lot about working directly with families and children, that we also felt that it could be applied more broadly and widely to the community, and that communities could be built and supported in a way to promote the development of protective factors in families. And then through that, we were able to hone in on one protective factor in particular, which was around promoting social connections, that now kind of is our guiding star in our work for Essentials. So that's kind of where we're going, and we'll kind of take you through our journey in getting to there.
So next slide, please. So next slide, Kaylin.
Sorry about that.
All right.
There we go.
Well, I'll just start talking about the next slide, and maybe it'll show up. It's been a funny day here in Massachusetts with technical issues of various sorts. So as Sarita was saying, And as Susan named, the CDC really kind of identified that the Strengthening Families framework had typically been mostly focused on the individual and family level, and Essentials is focused on a more macro scale. And what we were curious about is whether we could pull some of those, that framework and the protective factors specifically into a more macro and collective responsibility perspective, which is really key, there we go, to Massachusetts. And the main way in which we are focused on doing that is around promoting social connection in communities, and that's something that's emerged. In Massachusetts, there are 4 teams based on the 4 goals that Sandra outlined earlier. And so what we're going to do is we're going to walk through the 4 teams and how each of them is focused on the protective factors in various ways. So next slide, please.
So first we'll start off, sorry, this is Sarita again, with our data and evaluation collective impacting. So if you're wondering how did we get to this sort of our guiding star being around building and promoting social connections as one of our central themes. And it began with the survey that the CDC did around norms change. And so the CDC used Massachusetts as one of the states, and we were able to get some really great data about how families felt around social connections, and in particular seeking help. And then we did another follow-up study of that within Massachusetts, and that continued to emerge as a theme. And so what we found was that while families, particularly families caring for children under the age of 5, would say it wasn't going to make them a bad parent to seek help for their parenting, the vast majority still didn't. And this was even true when they believed that people who were important to them would not judge them for seeking help. They still did not seek help. And so that started telling us a lot about what happens with families when they don't feel like it's okay to ask for help even when they need it. And this, again, led us then down the road to, well, this is about people who are feeling perhaps vulnerable or unsure in their social connections, enough where they feel like they can really take advantage of help seeking and getting the resources that they need. And it's more than just the concrete needs, it's really even the support and being able to count on someone else to support them in their role as parents. And so this then became a real theme for us. We wanted to understand more and talk more and understand more about families wanting to be connected to each other in such a way that they informally are able to support each other and get the support and help that they might need in their parenting role. And so then we started to apply this into our evaluation frame. So for Essentials, we are looking at overall, across all of our project work, how are we building and promoting protective factors, in addition to within the individual collective impact teams. As Deb said, we have 4. So one that's focused on raising awareness, one that's focused on norms change, one that's focused on policy change, and one that's around how we're collecting metrics. And so we've applied that then, the protective factor framework, into our evaluation. One of the areas that we are continuing to challenge by, and I believe Marilyn described this, is that there are a lot of data metrics that talk about the things that are going wrong in families, but very few metrics that are about what is going well or how we are building and promoting protective factors. And so that's part of what we're looking to do by measuring the impact our Essentials project is having across building protective factors. So it is working across our shared metrics that all of the collective impact teams are working on, our overall metrics for the whole project. And now we're in a place where we are thinking about what we're calling legacy metrics. So we know that the funding for Essentials is going to be ending soon, but we don't want our work to end. We really feel like we're just getting going and certainly starting to have this discussion about how can we continue this work, particularly when we're looking at work that is around looking at things that are working well in families, in communities that are promoting protective factors. And so one of our charges now is looking at both what measures can we find that we can use over time in some reconstituted group or some ongoing legacy group. We don't have quite the structure that Washington has with other funds and other state agencies to continue the work, but we're hopeful that we'll be able to use sort of in-kind resources to make that happen. So looking at metrics, and then we're also looking at our partnership, our larger team. We do have the partners that were already described by Sandra and others. So we know we have programs that are funded in state agencies already that are asking families a lot of questions, collecting a lot of data, and trying to define what might be legacy metrics that we can use in existing programs and existing data collection systems so that we'll continue to generate these data over time. In addition to that, we're also going to be doing another pass with this norms change survey to continue to see what families' attitudes are around getting and seeking help and building social connections.
So next slide, please. I can see we only have 4 minutes left, so I'm going to try and zoom through these next slides. I didn't call this out earlier, but we've got a logo, which you can see at the bottom of this screen, which is the next revolution for our Commonwealth. So we wanted to have a tagline that really spoke to the issue of collective responsibility and seeing child wellness as a social good that all of us could and should promote. And one of the things that we did, and it speaks a little bit to the Washington button thing, was that we are honoring folks in the community that are doing this work to build protective factors. So we do that through honoring what we call essential agents of change, and you can see in the center the gentleman there. Behind it says Knowledge of Parenting and Child Development. That's a picture of an award that he's just received. What we do is we have been honoring groups for the last 2 years at the summits that we've been having that build protective factors, one of the 5 protective factors, but do not focus on child welfare, so that when we call them and say, congratulations, you won this award, you help to prevent child abuse and neglect, they say, no, that's not what we do. And then we say, yes, in fact it is. So if you can advance the next slide, please, I'll show you for the first year the folks that we honored. Just because it's more concrete and it makes more sense. So under concrete support in times of need, the first year we honored a group called New Lease for Homeless Families that provides a really innovative way to lead homeless families into long-term housing. The Somerville Cultural Council, a huge array of different kinds of festivals and ways for the community to engage. And to engage across different kinds of cultural boundaries where different groups are celebrated. The Toxic Soil Busters was a group of adolescents that started a business in lead remediation, and so part of what they were doing is going out into the community and educating folks on the dangers of lead poisoning for children, so we honored them under Knowledge of Child Development. The Children's Room we honored under Parental Resilience. They do work with families who are grieving loss of either a parent or a child. And then the Eric Carle Museum for Picture Art we honored under Social and Emotional Capacity for Children for work they were doing both at the museum but also in the community around teaching parents how to read to their children and how to engage with the material and what they were seeing in the books, but also with the children and in developing the children's ability to connect with the books and with their own imagination. So next slide, please. So the policy team has 3 things that they're focused on. The first thing, and on the right-hand side you can see a picture of it, of an infographic we did about paid family leave. So that's a big issue that's up in Massachusetts right now, and something that that team has been working with a variety of community partners and advocates to try and see how we can, in particular, shine a light on why it's good for children and families and communities, because there's been a fair amount of research on why it's good for business. And so we thought that the essential thing to do was to really focus on, again, on child wellness as a social good. That's something that's good for all of us. The second thing that that team is focused on is plans of safe care, which again speaks to the holistic need for to look not just at a child, plans of safe care, I'm sorry, for substance-exposed newborns. So to look not just at that child and often mother, but to look beyond the parents to other members of the family, and to look holistically and to make sure that things like housing and employment and other kinds of things might be addressed. And then the final thing that we're starting to focus on potentially is to look at promoting different kinds of practices that build social connection in communities, and that's something that's emerging. So next slide, please. But one of the things that we have talked about is something kind of similar to what Susan was describing, with this interesting way for communities to interact with sharing ideas about things that they think help to build communities and have been valuable for them and would be valuable for them. And then the final team is Norms Change, which really identified the social connection framing for us to begin with, and now is embarked on a storytelling initiative. These are 3 people being interviewed for that. It's a video storytelling initiative that's really highlighting the power of social connection. What we're hoping is that the final product will be created in a way that allows it to be built upon by others in the future. And then the last slide is our next step. So one of the things that we're interested in doing, and I may call you Susan, is to do a possibly interactive type product to gather and share information that's kind of similar to what you were describing, I think, about the kinds of community services and events that promote social connection. A companion idea is a possible checklist for mayors on things that make communities more socially connected. And then, as Sarita said, we're planning on sort of an Essentials 2.0 to carry the work forward. So legacy measures, aspects of the framework that we want to pass on to community members, and a new leadership team, and just generally how we can sort of bequeath the work to others who have been working with us, our partners, to continue it as we come to the end of the funding from the CDC.
Wow, thank you so much. You shared such great information, Deb and Sarita, and I know you had to rush a little bit, so I appreciate that. We are at the end of our time together, so we're not going to be able to take questions. However, you can send comments to myself and to Martha, and we will get them to the right people. And we would love to hear your thoughts about this. As I said, we won't be able to release the recording of this webinar as quickly as we usually do, but we will send a follow-up message to everyone who registered for the webinar once that recording is available to be shared. So thanks everyone for participating. Thanks Sandra. Thank you Deb and Sarita and Susan and Marilyn. It's been wonderful to hear all of the great work that you're doing, and to know that we're also aware of how these frameworks intersect and connect, and how we can strengthen our work by using different resources in different settings. So thanks everyone. Have a great rest of your day, and we'll talk again next month. Thank you.